Every time I hear disrupted health system, my brain cells recall the tsunami in 2014 in Indonesia, the earthquake in Haiti, Pakistan, Philippines, the war in Iraq, Yemen, Syria, just to name few. Such unfortunate events always led to a sudden change in the provision of healthcare. The collapse of the National Referral Hospital in Haiti, for example, further to the earthquake, has disrupted the entire patient referral system in the country. The ongoing cholera epidemic in Yemen is resulting from high rates of malnutrition, food insecurity, and most importantly, the collapsing health system. The world has witnessed many waves of the marginalized Rohingya influx from Myanmar into Bangladesh. However, August 25th, 2017 was by far the biggest. The United Nations, agencies, and NGO partners have recently made a joint appeal to meet the urgent needs of almost 1 million Rohingya refugees and more than 330,000 vulnerable Bangladeshi in the communities hosting them. Hello, my name is Mariam Abdelkerim. A year ago, I was one of the initial students who were awarded the scholarship for the Erasmus Plus MIH distance learning. I still recall mentioning to virtual classmates who I happened to meet at the end of the program that the light at the end of the tunnel is getting brighter. Most of you, I trust, must have gotten ahead in your thesis writing steps. You know, initial literature review, clear objectives, ethical clearance. Well, 4 more months to go until graduation. As for me, shortly after I graduated, I was asked if my name could be added on the potential list of health professionals to be deployed in the humanitarian response to Cox Bazar. Honestly, I didn't even know where Cox Bazar was. I had to find out and get into the news. Of course, I knew what was happening in Bangladesh, but not Cox Bazar. After my experience in Haiti and Libya a couple of years ago, I was longing for an Asian experience, therefore I did not hesitate. On October 15th, I joined the search team of the International Organization for Migration as the Health Program Manager. This is a big career step for me. I worked with a team of more than 135 medical and administrative colleagues. Beside the programming aspect of my functions, I had to travel to the field regularly and match project proposals, as well as reports with reality, but also address findings that required immediate attention. I benefited tremendously from the knowledge acquired during the MIH. I would refer here to drafting project proposals, reviewing literature to understand a particular phenomenon involving Rohingya health, but also using GIS for mapping purpose. By GIS, I refer to Geographic Information System, which was essentially used by all sectors, WASH, camp management, site development, etc. I particularly looked back and was grateful for the introduction course I attended at KIT. I used it immediately during my thesis. Therefore, when I was in Cox Bazar during the diphtheria outbreak, with the assistance of my information management colleague, we used it for mapping the IOM-operated isolation and treatment facilities, as well as contact tracing for patients who were assisted in our facilities. The 2 sub-districts of Cox Bazar, namely Ukiah and Teknaf, Upazilas, where the Rohingya have crossed into, are among the 50 most socially deprived out of the 509 of the country. I would say the difficulties in the terrain, the bad roads, the insufficient infrastructure contributed to poor living conditions. Consequently, the massive influx, spontaneous settlement in such a small area created enormous public health challenge, which are still ongoing. Every sector was mapping their activities, as I mentioned earlier, using GIS for programming purpose. The following relates to the Kutupalong camp, the mega camp, where more than 500,000 individuals are living. You'll see that the dark gray and green colored areas are marking the overall refugee population prior to the August 25th massive influx. The health sector published, as you can see, in November, its first mapping of the health structures within this mega camp of Kutupalong. You will see that the red dotted are the health facilities. They are basically clustered around the main roads and the walking paths. This means that if you live, for example, in the center of this map, you definitely will not be able to access healthcare. Of course, the sector was not happy with that, and this was one of the main reasons why health sectors partners were reminded to look into the positioning of their health facilities. And in December, when the mapping exercise was concluded, we can see here that the red dotted are many, but they are also following the population movement. So you can see also that the gray marked facilities are actually the upcoming ones. They are either under construction or have not yet been finalized. New families, as well as families requiring relocation either because of road or bridge construction, or simply to decongest the highly populated area. And here I refer to the center of the map, mainly the area of, I believe it was Balukali particularly, were guided to settle in the gray colored area on the western part of the map. I have been in two emergencies. I have worked in two emergencies prior to Cox Bazar, and equally, I was impressed by the intersectorial coordination. For instance, health was led by the host country, and here I would refer to the Ministry of Health of Bangladesh with the technical guidance from WHO. So as early as October, some preventive measures were strictly provided and implemented at dedicated transit camp, where newly arrived group people were gathered before being relocated to their final or temporary destination. However, this did not prevent from seeing the emergence of diseases that is particular to such a crowded and fragile environment. I would probably mention here measles, diphtheria, acute watery diarrhea was common, acute jaundice syndrome, and other vector-borne infection, etc., just to name a few. One other thing that I wanted to mention is that mental health, protection, sexual and reproductive health, including adolescent health, wash, education, nutrition, shelter needs continue to be addressed. I was particularly shocked by the number of visitors in the camps who were taking photos. And I refer to those who were just taking photos of Rohingya women, children, men, without bothering asking for consent. Late November, I had the great privilege to witness an elderly man who was interviewed. He was mentioning about how safe he felt been in Bangladesh, and he hopes that one day justice will be made. His words were clearly translated by a young Rohingya man, to whom one of the delegates thanked. As we continued further visiting the camp, one of our delegation member tripped and fell. Suddenly, a group of Rohingya rushed to rescue him. They helped removing dust from his clothes while asking him if he was okay. I particularly loved that moment where all of a sudden we all came together as human beings. One other thing that I wanted to mention is that apart from very welcoming authorities in Bangladesh, I noticed the kindness of the host community. They were sincere to their neighbors. While visiting 2 of the 3 main hospitals, I have witnessed local patients sleeping on the floor while letting Rohingyas occupying the bed they had. The Cox Bazar 200-bed hospital is the only referral hospital. It recorded more than 600 admissions daily. So at every particular day you go there, you would have 600 people there. Provision of extra warm meals was absorbed by the hospital workers, as well as in-kind contribution, at least at the very beginning of the emergency. I also met 2 alumni from KIT and many other health professionals from across the world in Cox Bazar. The Bangladeshi health workers are remarkably thorough and ready to help. By mid-January 2018, at the end of my mission, our team had almost doubled in size and in facilities. You can only imagine then the size of the public health challenges. I wish to stop here, and I wish you all the best with the rest of the Erasmus program. I hope you enjoy this course in particular. Thank you.